Hi, this is a high-level overview of our newest software called Clinical Care. First, we open the Clinical Care app, and this shows our mobility triage report. This gives clinical staff a quick and easy overview of how their patients did yesterday toward reaching their mobility goals. In this example, I have 3 patients, Fletcher, Frederick, and Zoe. Frederick and Zoe met their mobility goals. This is because they achieved their goal of their daily steps, which is how many steps they did yesterday, their peak steps per minute. This is their minute with the most steps in it, and then their active minutes. These are the number of minutes they had that had walking in them. Fletcher did not meet his mobility goals. This means that the clinical staff should prioritize checking in on Fletcher. This means I could either visit his hospital room or find out why through our messaging system. So here I can just go to messages and choose Fletcher from my patient list and may type "How are you feeling?" So I type to Fletcher, how are you feeling? Any reason you did not meet your goals? So this is nice because it signifies, you're watching, you care, and there is accountability. Now there is a separate, what we call Clinical Care Companion app that is optional that patients can use. And so I'm going to open that one so you can see what that looks like. All right, so this would be it could be on Fletcher's own mobile device, or the hospital could provide their own mobile devices, such as an iPad for the hospital room. If it goes to message, you see what the staff messaged. How are you feeling? Any reason you did not meet your goals? And this is an opportunity for the patient to say if anything is wrong. So in this case, I'm saying that I am in pain, and that would signify, a clinician should stop by and better understand what's happening. So on the patient app, they can get an update on their goals by tapping Update Now, which is getting the stopwatch data into our cloud. So this is now updating on both the clinician app and the patient's app. The patient can only see their own data, so no looking at anyone else's. And if your patient doesn't want to use the app at all, but the app is in the hospital room functioning, there'll be automatic updates at night. So even if a button is never pressed, you will at least get updated information from the day before when you look at the data in the morning. Okay. Now we're going to get back to the clinician app. Okay. So another important information about the clinician app is that you can also, do updates on the clinician app itself. You don't have to use the companion app. To do so, you tap Connect to Stopwatch. You can do it by placing the stopwatch on the iPad or selecting it here. Here will give you a rundown of what's going on in terms of the participant ID and stopwatch ID. And here you can tap Upload Step Data. Another really great feature of the clinician app is the Start PT session. So we're going to connect just this way at this point. When you start the PT session, what that means is it allows you to see, stepping data in near real time. So you'll see the steps are incrementing as they go forward. And in a little bit, you'll start seeing the other data begin to populate as more time goes on. So this is really nice for treadmill walking or over ground walking when you want to know, how many steps they're taking during the session, what the cadence is during the session, and how long they are doing it. A lot of hospitals want to monitor progress during therapy, and they need to monitor that progress separately from the walking they do outside of therapy. So this allows you to do that. So you'll see it starts with the dot just in the bottom left-hand corner. Once we hit at least 1 minute, you'll start seeing that the averages get graphed. Okay, so now we've moved up to where we have the average steps per minute, which is 116 steps per minute. And then as we move forward, the line will progress like people are used to seeing when they walk on treadmills and they're looking at their walking progress. I'm going to just hit stop. So this is an opportunity to state what kind of session this was. I'm going to put treadmill. And yes, I do want that data saved and in the cloud. Great. So one thing really important to note about this product is that StepWatch has many validated clinically relevant metrics that this system utilizes for optimal patient outcomes. That's where these patient mobility goals come into play, and you can change them as patients improve. If you have any questions, about the product and about our clinically relevant metrics, you should reach out to us. Our email address is orders@modushealth.com. Thank you.